discuss about endocarditis. Okay, it is a one disease condition to the cardiovascular system in the children. Okay, it will be there in the child health nursing subject, 6th unit, that is the children with various disorders and diseases. Okay, what is meant by endocardium? Endocardium is a covering layer of the heart. Okay, in the heart structure, that is the endocardium. Okay, that covering layer getting some infection by the viruses or bacteria. Okay, due to that the endocardium having some infection or the inflammation. Okay, simply we are called as the infection to the endocardium of the muscle. Okay, that we are called as the endocarditis. Okay, the inflammation of the endocardium of the heart. That is the definition of endocarditis. Okay, next we will discuss about causes. What are the reasons? What is the cause for endocarditis in the children? Okay, in that first one, that is the gram-positive organisms. Okay, what is there? That gram-positive organisms. Okay, due to that one classification is there, no, gram-positive bacteria, gram-negative organisms, gram-negative bacteria. Okay, especially the endocarditis will caused by the gram-positive bacteria. Okay, what are the gram-positive bacteria? Staphylococcus or streptococci or the alpha hemolytic streptococci or enterococci or haemophilus. Okay, these are the organisms belongs to the gram-positive organisms. Okay, what are that? Alpha hemolytic streptococci, staphylococci, next enterococci, haemophilus. Okay, these are the major organisms for cause of endocarditis in the children. Okay, once the children may be getting this infection due to these organisms, the children may be prone to get one disease of endocarditis. Okay, these are the causes. Next one is the pathophysiology. Okay, what is the process for occurrence of disease? Means in this due to etiological factors, means that is the gram-positive organism, streptococci, staphylococci, enterococci, haemophilus. Okay, these organisms may be, okay, due to the children may be have or may following poor environmental status or poor personal hygiene or poor oral hygiene. Okay, due to these reasons, the children may risk for receiving or the organism will be enters into the internal organs. Okay, once the organism will be enters through the nose or mouth or ears, whatever it may be, which organism having risk for getting infection. Okay, the organism not maintaining good personal hygiene means the organ maybe enters or maybe receives that infection. Okay, due to these reasons, poor personal hygiene, poor environmental status or poor eating habits, whatever it may be, the children are having low immunity power, low tolerance, less tolerance of diseases. Okay, these are the reasons for enter of organism into the human body of children. Okay, in this what happens means the organism should be enters into the body directly, that will be mixed with the blood stream. Okay, once we are inhaling impurified air or contaminated air we are inhaling, means in that air the organism will be there. Okay, the organism should be enters through the nose, but the organism should be mixing with the blood stream. Okay, due to that, why? Because the blood only comfortable place for growth and replication of their size and numbers. Okay, here what happens means once the blood should be getting some infection, means the blood should be there or circulates all over the body parts. No, here through the blood stream the organism will be reaches to the endocardium of the heart. Okay, after that what happens, let me see in this colonization of bacteria. Okay, means in that endocardium layer, that will be special and comfortable place for multiplication and their number, their size will be increasing. Next it will be leads to the humoral immune system will be activated. Okay, in that humoral immune system activated and non-antibodies will be received, means the antibodies should be released from the body. Okay, they are having less action, or they are not having good power for fight against the antigen, means okay, the antibody is killed by the antigen. Okay, that antigen nothing but staphylococci or streptococci or entterococci or hemophilus. Okay, these organisms increase their size, number, our body has released some antibodies that will be killed. Okay, it leads to what happens, means that bacterial clots. What are the bacterial clots is there? The clot should be travels from the one organ to another organ through the blood stream. Okay, in the blood the organism should be released some their toxins, means the toxins should be travels from one organ to another organ which is there in the body. Next it will leads to the damage of walls of the heart by doing some perforation. Okay, due to the some openings of the walls, the heart muscle or a heart layer should be damaged. Okay, this is the pathophysiology. Next we will discuss about clinical manifestations for endocarditis. Okay, what are the clinical manifestations, means first of all the children are having the low grade fever. Why? Because the children are having bacterial infection. No, once the bacteria is there in the body, the viral infection is there in the body, due to infection, due to that viral infection or bacterial infection, common symptom, the body temperature should be raised. Okay, that's why the children show low grade fever. Okay, next another symptom like the children are having the night sweatness. Okay, excessive night sweatings. Next another one is that the children are having the malaise and weight loss. Why weight loss? What is the reason for a weight loss in the children's, means the children are having one common symptom, that is the vomitings. Okay, once the children are taking food, but the food should not digested, the food should not will be forcibly vomited. Okay, forcibly expulsion of stomach contents. Okay, in that stomach the food should not digested, the food body didn't receive any energy. Okay, that's why the children will be having one symptom, that is the weight loss. Okay, next another one symptom like common symptom headache, myalgia muscle pain, arthralgia, that is the joint pains. Next another one is the splenomegaly. When we will observe spleen of the children, the spleen structure will be increased their size, okay, than the normal size. This is the clinical manifestations for identification of the children will be exactly suffering with the disease condition of endocarditis. Okay, next another one is the diagnosis. Okay, in the diagnosis, first step we have to do the, as a nurse we have to collect history from the children. Okay, is there any vomitings, is there any joint pains, is there any muscle pain, or is there any low grade fever or weight loss. Okay, these are the common symptoms we are assessed by doing health assessment or by doing history collection step. Okay, next another one is the blood examination. Okay, in that blood we have to do the erythrocyte sedimentation rate, another one is the WBC count, another one is the hemoglobin percentage. Okay, these we have to do. Next another one is the, we have to do the chest X-ray. Why? Because what is the structural abnormality is there in the children's body, that will be identified purpose. We have to do the chest X-ray and echocardiography, ECG. Okay, by doing ECG, the children are having any problems in the blood, that will be decided. Okay, last step, that is the management. In this management, the children is compulsory admitted in the hospital. Okay, once the children will be admitted in the hospital, then we have to do the we have to give some high dose of antibiotics. Why? Because the children are having this disease condition due to the bacterial infection. Okay, for example, the bacteria like staphylococci or streptococci or what is that enterococci or hemophilus. Okay, whatever it may be, which type of bacteria is cause for infection in the children, that is the endocarditis. Okay, for control of for reducing their what is that infection, we have to give some antibiotics, that is the penicillin or ampicillin or streptomycin or gentamicin. Okay, depending upon the which bacteria is attacked to the children for cause of endocarditis. How we will identify it? Exactly, the children will be suffering with the enterococci or streptococci, staphylococci means by doing blood culture. Okay, in that laboratory study, okay, in that laboratory we have to do blood culture for which bacteria. Okay, is there any infection due to the staphylococci or due to the streptococci or enterococci or hemophilus. Okay, for identification of this one we have to do blood culture. Okay, depending upon that we have to give ampicillin or streptomycin or gentamicin or penicillin drugs to the children. Okay, in this first we have to administer, that is the one medicine, that is the clindamycin. Okay, especially in that clindamycin having the dose 600 milligrams. Okay, in children we have to administer this drug means 15 milligrams per kg body weight we have to administer by orally. Okay, clindamycin is suitable for reducing the endocarditis in the children. Okay, next another one is this treatment we have to provide 4 to 6 weeks. Okay, this treatment will be giving to the children depending upon the which bacteria is affected, and we have to continue up to 2 to 4 weeks of duration. Okay, next last step, that is the nursing management. As a nurse, in every patient, in every children, we have to provide comfortable bed rest and comfortable position, calm and quiet environment we have to provide. We have to monitor the vital signs. Okay, is there any that heart rate decreased or respiratory rate decreased or pulse rate decreased or blood pressure problems? Okay, whatever it may be, what is the vital signs of the children? Okay, that we have to check and we have to record it, and we have to provide some diet therapy. Okay, in that what happens means which food will be improving our immunity, that particular diet we have to give. Okay, for example, we have to provide well balanced diet. Okay, balanced diet is nothing but the diet should be contain vitamins, proteins, carbohydrates, fats, some of the nutrients, minerals. Okay, we are taking balancing diet means we are not receiving any infection. Why? Because we are having so much of immunity power, means we are tolerate that antigen or bacterial infection. Okay, as a nurse we have to give some emotional support to the children, and we have to give some recreational therapy to the children by providing some music therapy or by playing some games. Okay, by entering or by offering friendly nature to the children. Okay, some neighbors which is the lovable persons is there for the children, that persons we have to meeting conducted, means by communication of that lovable children they are relieving their stress. Okay, next another one is the last step, that is the complications. Okay, in these complications due to the endocarditis, the children may have one symptom like, that is the blood clot. Okay, increasing their bacterial toxins in the blood means the blood should be maybe have that formation, that is the clotting. Okay, another symptom, another complication like brain abscess. Okay, due to these infection, what we have discussed means due to the staphylococci infection or streptococci or hemophilia or enterococci, these infection, these gram positive organisms release some toxins in the blood. No, the blood should be pumping or supply or pump to the all over the body parts. Okay, along with the brain also receiving some blood. Okay, in that blood having some infection means the brain may have some pus formation in that particular parts of the brain. It may be their brain abscess in the cerebrum or cerebellum or pons or medulla oblongata. Okay, next another one is the congestive heart failure. It is also one complication. Another one is the glomerulonephritis. Okay, next another one is the jaundice. Okay, jaundice also one complications. Here impairment of liver function. Okay, another one is the stroke. Here what happens, insufficient oxygen supply to the cardiac muscle, or okay, some neurological changes we are identified in the children who are suffering with the disease condition of endocarditis. Okay, in early stages we are identified this disease condition means we are preventing these complications. Okay, if early stages we are not identified, we are not providing quality of care to the children may have prone to get these complications. Okay, for preventing these complications in early stages we have to give correct treatment to the children. Okay, this is regarding endocarditis.